Dr. Finale, thanks for talking with me. I appreciate it. I know how busy you are right now.
Sure, happy to do it.
So I got the financial numbers from your team earlier in the day, and of course we heard from Lifespan this morning, and similar story in both of the big hospital groups. A lot of red ink, and while it's maybe not a surprise, the numbers are still striking. Can you put kind of into layman's terms for the average patient, employee, just Rhode Islander who cares, what these numbers mean for your organization?
Well, these numbers mean that this whole epidemic is not only causes a struggle clinically, which I think we're well prepared for. It's the financial implications of this COVID crisis. I mean, the fact that nobody's coming to ambulatory sites, electives are canceled. It's all the right thing to do in terms of being prepared for the clinical onslaught of sick patients, but it's been financially devastating to healthcare systems throughout the country, and specifically to us in Rhode Island.
Dr. Babineau said this morning, from his perspective, federal aid as well as any help the state can give is going to be a big part of getting Lifespan through this crisis, the financial piece of this crisis. Is it similar viewpoint at Care New England?
We share the same exact thoughts. I mean, there's little we can do about this. As he pointed out, at some point, electives will open up, probably sooner than later. But remember, I don't think it's all going to come back right away. If this came back, everything came back in May, we'll struggle through a couple of months, even though they're devastating losses in March and April. But I don't think it's going to come back right away. It's going to be slow. And who do we think it'll come back to the pre-COVID level of volume? I don't know. Are patients and families ready to come into the hospital, have things done? They may delay it even further. So we don't know when it's going to be over. But, as he said, we concur, is that April will be worse than March. And we've worked very well with the delegation. I met with them today by phone. They're very helpful. They're trying to help us. I think it's going to be a combination of the federal and the state coming through to help our systems to be able to get through this. I mean, we're the essential systems in the state. We have to be here.
I asked Dr. Babineau, you guys are also some of the biggest employers in Rhode Island. And so the first thing people wonder is job cuts, layoffs, especially with the economy as bad as it is. On the other hand, you have a big clinical need right now because you're worried about a surge and everything. Are you thinking about layoffs, job cuts at this point? Where's your view on that?
Yeah, the unique thing is when you have a volume, if you had a mild volume loss, you would then staff to that volume and you make those adjustments. This is a acute change, really a very acute change. And how do you respond when you're also trying to prepare clinically if all of a sudden a bunch of folks get sick? So we've had some voluntary furloughs where people wanted to take time off. This week we're talking to folks about some involuntary furloughs, which means 150 or so people would be furloughed for a couple of weeks at a time, only a couple of weeks. We would continue their benefits, their health insurance, and hopefully when things come back, they'll be brought back. But we are beginning to implement that this week.
When does this switch from being kind of numbers on paper that are alarming to a more, to use a hospital term, acute crisis, where you'd say, okay, if a ton of federal money hasn't come in yet, we're going to have to take some more radical steps. I guess another way to look is, how do you feel cash versus knowing where this is going and the need to have a plan?
Pretty soon. I mean, I think if, we've done everything right to prepare for the surge. We've all cooperated, all the hospitals, the two largest systems, the governor's done the right thing. We built the surge hospitals. Again, I said yesterday, maybe we'll never need them, but we had to do that. But I'm thinking that if we get through the surge and things begin to decline, which I think they're going to, according to the models we're all looking at, it could be in the next 2 or 3 weeks, we have to sit down and assess how we're going to get through this. And you can manage costs only so far, then it becomes labor, which is 60% of our costs. So, I don't even know how to plan until I know when this surge is over.
I also wanted to ask you, and again, I asked Dr. Babineau about this too this morning. I've been pleasantly surprised at the daily census of hospitalizations on COVID-19, just knowing some of the models we were all looking at just a few weeks ago. I've even heard about people who work in the hospital saying it's not that busy in the hospitals right now. What's it look like inside the hospitals right now as we're in the middle of figuring this out?
We're a little bit different because although women and infants is still strained, same number of deliveries. Remember, those are planned months ago.
Right.
And the NICU, it derives from whatever illness you have. But the surgeries and medical stuff, Dub and I is gone. But if you go down to Kent, which is similar, smaller though, but similar to Miriam and WNI, it's 60% full. So you walk around a ward where there are no patients.
What
Because
would it
again,
have been? How full was it before COVID?
about 180.
Wow,
So we're running
180.
about, yeah,
Wow,
160, probably 120 patients now, 180. So 60% of what it was. That's what we're doing. At the Cape, I talked to colleagues there, they're 40% full.
wow.
So people aren't coming, people aren't having elective surgeries. I think people maybe staying home and having untoward illnesses like heart attacks at home, which isn't safe. But that's the state of where we are, and we hope to rebound soon.
And people, Lifespan's talking about this a lot, that it is, you do have things in place because people worry, oh, I don't feel good, but if I go to the emergency room, am I going to be around all these coronavirus people? Do you have things in place to protect the non-COVID sick from the COVID sick?
We both do. I mean, I think the incredible thing that we've tried to say in the last week, he said it and I've said it, we said it together yesterday at the convention center. We can take care of everybody. Don't not come in. Everybody is separated, migrated, you're safe. But you know, the normal human reaction is, do I want to go there, right? But if you got something wrong, you need to come. Don't take a risk in your life. We can take care of you. Lifespan can take care of you. Don't stay at home and put your life at risk.
So long story short, how worried should people be about the hospitals in Rhode Island right now?
I think we're all concerned. We're very concerned. We're doing the right thing clinically. We're going to keep doing that. We are, you know, women and infants, Kent, Butler are vital assets to the organs, to the state, as are other hospitals, Lifespan for sure, and the other hospitals. But we are going to work very closely with the federal delegation and with the governor's office. Again, we met with them today. We have trust and faith that they're going to come and help us get through this situation. If they can't, then we'll worry.